Hi everyone, my name is Rose Schwal, and I'm going to talk about food deserts and how they might affect the public health in Arkansas. First of all, here's the list of contents we are going to talk about today. We are looking at the definitions of food desert and healthy food. We will also look at the contributing factors to making a food desert and its health effects on our community. I would focus on the environmental aspects of food desert, but since I couldn't find any information on that, I chose to focus on the effects it has on our healthcare system. There will also be a brief discussion of the comparison between supermarket and convenience store, followed by a few solutions to the problem, as well as what has been done and could be done locally. So how do you define food desert? According to the CDC, food deserts are areas where people have limited access to healthy food. In other words, these areas have low fresh food availability, meaning limited access to affordable, healthy food. These areas have a low number of supermarkets but higher number of corner or convenience stores. The USDA definition of healthy food consists of fruits, vegetables, whole grain products, low-fat milk, and other healthful whole foods. So, what are some of the contributing factors to making rural food deserts? The USDA highlighted 3 factors, which are income level, distance to supermarket, and access to vehicle. According to a study done by the USDA, the locals in food desert areas usually have to travel as much as an hour or more to access full-service grocery store. Nearly 10% of the U.S. population lives in a low-income areas more than 1 mile from the supermarket. You could see how this will put a burden on the elderly, disabled, and low-income people for whom transportation is a barrier. When you live as far from a grocery store as these people, having access to a vehicle is an important indicator for access to supermarket and therefore healthy foods. Here's a quick look at what a supermarket versus a convenience store would look like. With the supermarket, you would have more access to more healthy options at relatively lower cost. However, the number of supermarkets has decreased in the U.S. In food deserts, convenience stores fill the gap. Convenient food equals quick food, such as sweets, ice cream, soft drinks, prepared and often fried food. Additionally, according to a study, food in convenience stores is higher in prices. For example, results have shown that the price of milk was 11 to 14% higher in smaller stores relative to supermarkets, depending on the milk variety. On average, all items were more expensive in smaller stores than in supermarkets. As I mentioned in the previous slide, the number of supermarkets or grocery stores in the U.S. has decreased in recent years. This map shows the number of supermarkets or grocery stores other than convenience stores in Arkansas in 2012. In 2013, the number of supermarkets in Arkansas has decreased from 853 to 485 since 1997. 49 counties, which is 65% of Arkansas, had 5 or less grocery stores within their boundaries. This reminds me of the story of my hometown, Murfreesboro, Arkansas. Murfreesboro used to have 1 supermarket, but it closed down a few years ago. Now all it has is 3 gas stations and 1 dollar store, and 0 supermarket. And its neighbor town, Nashville, used to have 3 supermarkets, but 1 went out of business just this past year. Food deserts could have detrimental health effects on the community, such as obesity, diabetes, and hypertension. In the next couple of slides, I am going to show you three maps. Please keep in mind the darkened areas as we go forward. This is the first map showing the prevalence of no car and no supermarket store within a mile. This map shows the percentage of adults of 20 years or older who are obese in the US. This map shows the percentage of adults of 20 years or older with diabetes. Now, if you compare the three maps, the obesities and diabetes rates are higher when there are no car and no supermarket within a mile. Now we can look at the health impacts that supermarket has on the community. Studies have shown that supermarket reduces weight and reduces risk of adult obesity. Supermarket reduces weight of children in low-income areas, while presence of fast food increases it. People living in areas with limited access to healthy food have a higher prevalence of diabetes and hypertension, whereas seniors living in rural communities eat fewer fruits and vegetables the farther they live from the supermarket or the healthy food retail store. Let's talk about the impacts it has on the healthcare system. But first of all, food insecurity is an issue that goes hand in hand with food deserts. In food insecure areas, people are not sure where their food will come from. They have little to no access to nutritious food and are more likely to have unbalanced diets and skip meals. According to the USDA, in 2006, 35.5 million people in the United States alone lived in food insecure homes. Especially at risk are people living below the poverty line, Hispanics, African Americans, households with children, and those headed by single women. It's been shown that obesity is linked to non-nutritious food. For a lot of these folks, it's more convenient to go out to a fast food restaurant or to grab something quick at the convenience store around the corner than traveling to the closest supermarket, which, according to data above, could be challenging. As a result, obesity and obesity-related problems cost us about $100 billion a year. So, what are some things that could be done to combat food deserts? We could build more small grocery stores across the country, encourage convenience store enhancements to add more healthy options to the stores. We could encourage farmers market as well as cooperatives, add more regulations to help low-income people to have access to healthy food. And lastly, online grocery service is something new and seems promising. My research has led me to a few regional program examples, including the New Orleans Fresh Food Initiative, the Louisiana's Healthy Food Retail Act, North Carolina's Healthy Corner Store Program, and Alabama's Healthy Food Financing Act. Additionally, the Federal Healthy Food Financing Initiative provides grants, loans, tax credits, training, and technical assistance to eligible fresh, healthy food retailers. Arkansas awardees include Windrock International 21 and Fayetteville. The USDA also funds projects like Farmers Market Promotion Program. There's a new regulation to the Supplemental Nutrition Assistance Program, or SNAP, requires vendors to offer at least 7 varieties of items, each of 4 staple groups, including perishable foods in 3 of the 4 staple categories. The USDA has initiated a 2-year pilot program in 7 states that allows SNAP recipients to order online and use the benefits to pay for the groceries. The goal is to develop this into a national option for SNAP participants. Additionally, there are some grocery stores that offer online ordering and delivery services such as Kroger, Walmart, and Amazon Fresh. Lastly, I would like to go over some of the local efforts. We should provide financial support for local farmers market to address farmers markets planning, training, implementation, promotion, and sustainability. Fresh to You is a project of the Arkansas Hunger Relief Alliance. It is a mobile farmers market program that brings fresh produce to people living in food desert in Pulaski County. This program accepts SNAP and provides twice as much the amount of produce per dollar through the Double Up Food Flux program. Church and community gardens should be encouraged throughout the state. And lastly, youth education is a program that provides funding and it works together with other organizations. The foundation helps to establish or expand a number of diverse healthcare projects that would benefit all Arkansans over the long term. Thank you so much for listening. I hope you enjoyed the presentation. If you have any questions, please do not hesitate to email me.